Hi, I'm Dr. Maxine Jochelson. I'm a diagnostic radiologist, and I'm the director of imaging at the Evelyn Lauder Breast and Imaging Center at Memorial Sloan Kettering Cancer Center. So we're using more and more breast MRI, and MRI is a useful study because we give women dye, and the dye is called gadolinium. There are many different types of gadolinium agents, and that dye will show the new vessels that go to breast cancers. That's what we call neovascularity. And you can find a cancer on MRI by giving women dye before you can see a mass or feel a mass or even see something on mammography. So it's a very sensitive way of finding breast cancers. Every study and every dye has a risk-benefit ratio. And we try to get more of a benefit than a risk, but everything has a small risk. So gadolinium has a few risks. One is a gadolinium allergy. The gadolinium allergies are fairly rare, and most of them are not significant allergies. Women may get hives, or you may feel a little itchy. On a rare occasion, you may have a severe allergic reaction to gadolinium, and a very, very small number of women could potentially die of the allergy. But again, this is extremely rare. Another problem that we don't see very frequently is called nephrosclerosis. And this is a complication that occurs only in women who have end-stage kidney disease. So if they're in renal failure, they can get this thing where they get this thickening of their structures and can theoretically die. Now, you have to figure out whether or not you need to do MRI of the breasts in a woman who has end-stage renal disease, because the renal disease is more likely to be fatal than looking for an early breast cancer. However, this complication certainly is important if you're doing MRI for other reasons. But I think the reason you asked this question is more recently, people have demonstrated that women, and probably men as well, when they have multiple MRIs, get gadolinium deposits, which they have seen on their brain MRIs. And this is what I'm showing here with the arrow. You see this little area of white in this brain MRI, and that's the gadolinium. Now, this is something that you can see in the brain. You can actually see on autopsies in multiple structures in the body. We have looked at whether or not this is associated with any real pathology. And so far, nobody has demonstrated that when you do an autopsy or when you do a biopsy, and you may see the gadolinium deposition on the MRI, but the tissue next to it does not look abnormal. Patients don't get sick because of it. So that it really is probably extremely safe, regardless of the fact that you can see the white on your imaging study. We have learned that the different types of gadolinium have different risks for deposition. And what most of the manufacturers are doing now is they're producing the gadolinium that's safer, and they're also looking for other contrast agents that do not have gadolinium. We do know that the gadolinium deposition is more likely the more MRIs one has, but I really don't think that the gadolinium deposition should prevent women from having their screening MRI or having MRI for other reason. Despite the fact that you see a finding on MRI, it is not likely to be harmful to the patient. So for those of you who are worried about having too many MRIs or having screening MRI, I really would not use the question of gadolinium deposition as a reason not to have something that will find early breast cancers and save lives. Another possible approach is to try to do MRI without contrast. We looked at 110 breast tumors, 41 benign and 69 malignant in our patient population. And we demonstrated that you could see all the cancers when you use contrast, but if you don't use contrast, you only find 82% of them. So you would be missing 18 cancers per 100 women if you didn't use the contrast. So therefore, currently, one must use gadolinium until the new agents have been developed. Eventually, we may be able to do better with MRI techniques without contrast, but for the time being, get the contrast and get the screening exam.